You're listening to the PGX for Pharmacists podcast, part of the Pharmacy Podcast Network. Pharmacogenomics is the study of how genes affect a person's response to drugs. This revolutionary science combines pharmacology and genomics to develop effective, safe medications and doses that will be tailored to a person's genetic makeup. There's no better healthcare provider positioned to leverage the analytical power of pharmacogenomics to provide more effective medication therapies and outcomes than a clinical pharmacist. And now, here's the host of the PGX for Pharmacists podcast, pharmacist, researcher, and national pharmacogenetics expert, Ken Sternfeld.
Good morning. My name is Ken Sternfeld. I am the founder of RxVIP Enterprises, and you are listening to PGX for Pharmacists podcast.
Hey there, Pharmacy Podcast listeners. Better yet, the expansion of the Pharmacy Podcast Network. You know, I have been very interested in something that's within the world of pharmacy and pharmaceutical and patient care and technology. About 3 years ago, I met a man in South Pittsburgh in Greensburg, Pennsylvania, named Dom Meff, who launched a company called WellMed RX. WellMed RX really focused on technology to empower physicians that wanted to find out, is my patient a candidate for a pharmacogenomics test? And from that, I blew up into a project with him. He's a wonderful man. His son owns several healthcare companies, including a large pharmacy that was bought by Kroger in the specialty pharmacy arena. His name is also Dom Meff Jr. What a wonderful family. What an incredible science to be working on and using to really define what our patients are experiencing and the outcomes that they're experiencing and the medications that they're taking, if those medications are working, the efficacy of that medication. There's so much swirling around in my head. I've been interested in pharmacogenomics for some time. So I met a man through LinkedIn. I love the fact that LinkedIn is doing exactly that. It's linking us into each other. Mr. Ken Sternfeld, he is the founder of RxVIP Enterprises Limited, a concierge pharmacist, a customized pharmacist who believes in the power of pharmacogenomics. Ken and I are launching a new program today, part of the Pharmacy Podcast Network, called PGX for Pharmacists. Ken, welcome to your own show. How are you today?
Thank you, Todd. What a great introduction. Very excited to be with you and your listeners. Thank you so much for having me join your team.
You're very welcome, Ken. We're really interested in bringing back some consistent conversations about pharmacogenomics and how it's becoming demystified. It's also becoming less expensive. And I think it's part of the science of being a pharmacist that is underutilized. And it's why I'm excited that you're joining the Pharmacy Podcast Network co-host membership base and really starting to get a monthly show out there to demystify this whole pharmacogenomics thing. So let's set the stage. Give some background on yourself and your organization and how you got involved as a pharmacist in pharmacogenomics.
Thank you, Todd. I'm a registered pharmacist, graduated back in 1979 from St. John's University. I worked for a very short time in retail pharmacy at that time when I graduated because I moved into a family-owned business in consumer electronics and left the industry for about 27 years. So I took a little bit of a break, but while I was on the break, I learned some consistent tools about engagement, about business, about how to do customer care, not necessarily for healthcare, but just in terms of connecting with consumers. And through the consumer electronics experience I had and the business knowledge, when I came back to pharmacy, I utilized a lot of those core competencies to bring what I think is a better level of patient care and a more enhanced role for the pharmacist in the healthcare system. That's our goal, to enhance the role of the pharmacist and obviously for all of us to get provider status to be recognized as true healthcare providers, which pharmacists are.
So Ken, PGX, pharmacogenomics, has really been focused initially on a specific drug that everybody knew was the culprit, which was Plavix. However, kind of expand beyond that because it's applicable in so many other medications. As a matter of fact, when I was doing some studies with Dom Meff and his team to build out the application that I mentioned, they actually had identified 160 medications that were the top candidates for a actual PGX test. So kind of round that out for us.
Well, actually, the amount of drugs is consistently to grow. FDA puts black box warnings on about 160 drugs that the pharmacogenetic test is not only required, it could also be highly recommended. Because the medications that we dispense as pharmacists, because they are each individually dealing with individual reactions from the patients, there's no one size fits all. So a drug that works for you, Todd, may not work for me. And that's really the basis of pharmacogenomics, that it's a personalized understanding of what drugs, what dose are correct for the patient. For me, with pharmacogenetics, it wasn't specifically about the drug. It was about the impact of the adverse drug reaction, which sadly affects millions and millions and millions of people. So as a pharmacist, that was really what drew me to pharmacogenetics, the clinical aspect, but also the personal aspect that each of us has had, sadly, someone in our family or a loved one who's experienced an adverse drug reaction.
How would you suggest, and I think it's different for each setting. Okay, so let's break it into these sectors of pharmacy. We have community pharmacy, long-term care, senior care pharmacy, specialty pharmacy, hospital system pharmacy, compounding pharmacy. There's so many sectors. I think pharmacogenomics could really play into any of those. But as a pharmacist and as a concerned clinician, how would you coach a pharmacist to actually even get started?
I think the coaching starts in the culture of care. If we as pharmacists and healthcare providers are concerned with care, compassion, empathy, professional consultations, in addition to the fact that we have to count bills to put those prescriptions in the hands of patients, we get a better perspective of what we call a concierge pharmacist is. Someone who takes the time, makes the time to focus on the patient. It's not a metric. It's healthcare. It's about the person. You mentioned 5 or 6 categories of pharmacy and said every or any of those could apply for pharmacogenetics. You are exactly right, because in all of those settings, you have a pharmacist or a PharmD or a student of pharmacy who is there entering our profession because they care. So it's not the work environment, it's the culture of the professional. If you want to become a concierge pharmacist or PharmD or a care provider, you can by embracing pharmacogenomics, which is the future of medicine today.
I think it really slows us down from being a transactional pharmacist, which many pharmacists feel like they've become through the environment of community retail pharmacy. And it's turning pharmacists back into the clinicians and the value that they bring to the patient's life, as well as the value that they bring to that healthcare continuum team, to becoming that medication expert as we are as pharmacists. So with that new tool in your hand, the pharmacogenomics, the pharmacogenetics tool, I am curious how a clinical pharmacist in a hospital setting or long-term care setting brings information to the management team table to say, here's something that's going to differentiate our services to our patients based on the fact that this science is necessary as a part of being a pharmacist. Because in my mind, Ken, I think that this should just be part of the everyday thing in the life of a pharmacist, in the life of a pharmacy professional. But that's just not the case in reality. And I think PGX is overlooked still to a point. I think it's talked about more than it's ever been talked about. But I think we need to fast forward and start utilizing it as just a normal part of a pharmacy professional, pharmacist, clinical side of their services that they offer to a patient. So I know that's a very wide standing 30,000 foot pullback, but what I'd like from you as someone who's really kind of seen the benefits of this to patients is kind of give us a how to even get started and how to develop that conversation, even using this podcast to kind of drum up those ideas. If I'm a pharmacist, I'm interested in this, how do I bring that to the table to the rest of the management team?
That's an outstanding overview of a circumstance in pharmacy that we all live with. How do we do what we went to school for? How do we practice at the height of our license? What I did, and I'm just one pharmacist, I'm trying to impact one patient at a time, is I took a day off from retail pharmacy. I was a retail pharmacist working in environments that are challenging, doing great numbers and getting scores and metrics and all of that, but it was pushing me further away from the patient engagement of what I wanted to do. So on my day off, I happened to be off on Fridays, I went to the point of care. I went to my physician and I said, I'm a pharmacist. Okay, I may be working at a retail pharmacy around the corner, filling prescriptions for your patients, but on my day off, I want to do more. I want to raise my professional credentials. Let me come to your office. When we talk as pharmacists, we represent the environments we work for. Okay, I didn't want to represent the environment I worked for, except when I was there. But when I wasn't there, I wanted to represent who I am as a healthcare compassionate individual who wants to help patients. So I created on my own Pharmacy Friday. And the pathway was take a day off from retail and become a concierge pharmacist. Make the time to listen to patients, to help them, to counsel them, and to use your expertise. And that is the pathway. Sadly, the environments you mentioned previously don't afford or allow the development of the pharmacogenetic consultation, of the caring, compassionate nature that a concierge physician, a pharmacist needs to do. They can't happen seamlessly in the retail environments or even in the hospital environments. As a pharmacist, you have to go to the point of care, talk to the patient, listen to the patient. And this starts, think about why you went to pharmacy. Think about if you went on your first class at the university that you signed up for, if they were talking about how genetics are the wave of the future, they're here, how a test can predict the medication that's right for you and the dose, you'd be excited. So we mentor the next generation, everyone from the first day they enter pharmacy until they retire from pharmacy, like I recently did from retail, needs to know that pharmacogenetics is where a pharmacist needs to be. We are the pharmacist expert of medication who better to review and dialogue and consult. So every environment and every pharmacist can deliver pharmacogenetic testing. And we've developed the systems to adapt to the changing landscape of pharmacy. We have programs for students. We have programs for PharmD candidates and interns. We have programs for existing PharmDs and pharmacists who work in chain stores. Now, you're not going to be standing at a chain store counter and pitching pharmacogenomics, or PGX testing. That's not what they're doing. So you're not going to do it there. But on your day off, you can certainly collaborate with physicians in your own neighborhood. Go to your own physician. That's how RX VIP Concierge started. I went to my own physician and I said, I need to do more as a professional. So we started with one practice with 250 patients, and I was there Pharmacy Friday helping out. 2 or 3 weeks after we started, I was seeing more patients than he was. Who wouldn't want to see a pharmacist?
That is brilliant.
Okay.
Ken, that is brilliant.
That's how it starts, Todd. And it really is a fulfilling, wonderful, professional, and financially rewarding business model that we've created.
So what's really funny, Ken, is to listen to you thinking you've actually thrown yourself during a normal 40 to 60 hour a week job. You've thrown yourself back into creating your own internship per se to actually help create this knowledge to the physician that you're helping, that this is what pharmacists are actually supposed to be doing. We're not supposed to be just in a retail space and chugging through 600 prescriptions a day and being a volume go-to jockey, that's not pharmacy. We have technology to handle lots of that, and there's new technologies coming out. Pharmacogenomics plays into the value of the pharmacist as the medications expert, ensuring the lives of the patient make it to recovery, make it through the therapy, and to be blunt, don't die. So when I think of a recent article that came out November 28th, 2017, Fred's Pharmacy customers talk about consulting with their pharmacist because they're afraid they're going to lose their pharmacist. Fred's Pharmacy is a big grocery store-like pharmacy out there, and they're cutting a bunch of jobs. And I hear all this rickety ratter and run around and worry about pharmacists saying, this is a volatile marketplace and what's in it for me, and maybe I shouldn't have become a pharmacist. I think it's exactly the opposite. I think if you want to differentiate yourself as a pharmacist, and if you want to do the entire reason that you went to school in the first place, and what you should actually be passionate about as a pharmacist, is doing things that go above and beyond what that clock punching pharmacist does. So if all you want out of life is your clock punching pharmacist, this podcast is not for you. The entire Pharmacy Podcast Network is not for you. But if you're innovative, if you're hyperactive like I am, if you love information, you love technology, love innovation in our profession, and want to rise up, then this podcast is dedicated to you. And Ken, from your perspective as the go-to expert, subject matter expert on pharmacogenetics, tell us what you want to get out of this podcast and what you want to deliver to the Pharmacy Podcast Network.
Well, we want to raise awareness that a simple 2-minute buccal swab test can save lives. Adverse drug reactions are the 4th largest leading cause of death in the United States. We all dispense opioids in our dispensing world, and there's a national health crisis that the president and Governor Christie and news media, and you see it on the news that 64,000 people died because of opioid overdose. That's a horrific loss of life. But do you know that 125,000 people died last year because of an adverse drug reaction of something that was dispensed to them that wasn't right for their metabolism and for their genome, avoidable with a simple test. So as I want to empower our profession to raise awareness with physicians and most importantly, patients, that this life-saving test is available. Who better to deliver this test than the profession that is giving you that medication and should be concerned that, yes, it's helping you, but 2 million people went into a hospital last year because of an adverse drug reaction. Trial and error. You go to the doctor, okay, let's try amlodipine, let's try lisinopril, let's try this, and if it doesn't work, come back. Think of the trillions of dollars of healthcare savings done by eliminating trial and error. And with this test is the only way to do it. This will become standard practice. So my vision is to raise awareness within our profession from the first day that a pharmacy student enters a university until they complete even a master's program from a wonderful institution called Manchester, who has what I see as the first master's program in pharmacogenetics. Every pharmacist needs to care. This is the flu shot of the future. You're going to go to a doctor's office in 3 or 5 years. They're not going to take blood. They're not going to take urine. They're going to say, have you taken your genetic test? Genetics are here. This is not a new test. 9 years ago, it was introduced, very, very expensive. Now it's covered by Medicare. What Medicare patient wouldn't take this test if it doesn't cost a penny? A growing list of commercial insurances. So my passion, my mission, and the mission of our entire company, which is growing through inspiration, not perspiration, working at retail, flipping burgers and fast food pharmacy, but by inspiring to help people and save lives. Every pharmacist should be involved in pharmacogenetics to save lives.
Ken Sternfeld, PGX for Pharmacists podcast. Welcome to the Pharmacy Podcast Network. We're excited to have you. And with that, we're going to wrap up our first inaugural show, Kickoff PGX for Pharmacists. If you want more information on this, Ken, how does a pharmacist reach out to you?
Well, we set up an email address, PGX, very easy because that's what we are, at RxVIP Concierge. A concierge for pharmacist is a different pharmacist. It's kind of the brand name that I hope one day will be generic pharmacist who just count and lick and pour, and we'll be concierge pharmacists, will be the brand names that our patients, our physicians, our profession look to as the leaders. So PGX at RxVIP Concierge. You can also call an 844 number, MyRxVIP, and you will get directly contacted to me, and I will answer your questions. Committed to this project because it's not a project. My father-in-law suffered a horrific adverse drug reaction 5 years ago. I was his caregiver until he passed away. And we need to know that in everybody's life, someone you know or love had an adverse drug reaction, and you can help by embracing the concept of pharmacogenetics and delivering and administering and reporting on the results of those tests.
Ken Sternfeld's information will be in the show notes. You can always reach out to pharmacypodcast.com in our contact section. We thank you so much for listening to the newest segment of the Pharmacy Podcast Network, PGX for Pharmacists. God bless you, and we thank you for listening.